Healthcare is a mess, and it's affecting families across America. Even those with dual incomes are finding it increasingly difficult to afford health insurance. Everyday incidents like sports injuries, asthma, and blood pressure, combined with anxiety over rising premiums, are turning the American dream into sleepless nights. But why is this happening? According to the Consumer Price Index and Medical Care Price Index from 1935 to 2009, the healthcare spending crisis didn't start until the mid-1960s, around the same time that Medicare and Medicaid were signed into law. Since then, healthcare spending has doubled, even adjusted for inflation. Why is this happening? Well, one reason is that everyone wants healthcare, but there's only so much to go around. Short supply leads to high prices. Normally, when prices are high, entrepreneurs try to profit by finding more affordable ways to provide goods and services. The more people become involved in providing these services, the less scarce they become, and the lower the prices drop, so that over time, more and more people can afford them. This is what happened to televisions, microwaves, computers, cell phones, and even medical technology like LASIK. So, can't government drive down the price of goods and services like the free market? Unfortunately, the government's involvement in healthcare has led to higher prices, not lower. Medicare and Medicaid, for example, made the unfortunate less dependent on private charities and more dependent on political institutions and pharmaceutical companies. The government took over training new doctors and severely limited the number of trainees allowed. As a result, prices shot up, making it even more difficult for people to afford health insurance. Obamacare suffers from similar problems. It eliminated the pricing structure by seriously restricting competition because all providers have to offer the same kinds of plans at the same price. And because that price isn't really determined by the market, providers can charge the taxpayer way more than they could otherwise. It's basically just a handout to big insurance companies. But it doesn't have to be this way. If we get the government out of healthcare, more people will be able to get the care they need. Let's work towards a healthcare system that is affordable and accessible for everyone. Subscribe Libertarian Facts.